Well, welcome to the 7 o'clock talk, which has now been moved to Tuesdays for our dancing. And one of the interesting things that I really want people to start to take away from all of this is being active and having fun is part of being healthy. And we're sitting out in a park. It's a beautiful night. Going to go over and she has to have her annual pineapple whip from the fair. But getting out in nature, we want to divorce ourselves from nature so much. We like to think we're above nature, and we're really not. Most of the things that break us down are negatively charged ions or negative or a reactive oxygen species. And what makes things reactive or what makes it a reactive oxygen species is a negative charge on the molecule, and the earth has been shown to be positively charged. So when you are in contact with the earth, you are offloading negative charges. And this goes directly into acupuncture. So NASA has imaged, they've done what is called Correlian photography, and you can Google it. That has imaged the energy fields around the body, and they have different colors. That's where they talk about auras. And the beginning of this talk is going to be very kind of, for me, it's woo woo. It's very woo woo, very out there. I, it's not that I don't believe in energy work. I'm just not real good at energy work, Reiki and stuff like that. I am more of a scientific, hard facts. Let's look at this and do this type of work this way. What's been proven. So when we start to look at that and think about energy and think about what the Orientals call ki, we can't discount our being influenced by nature and by being in contact with the ground. And they call that work grounding. So when you walk around on the grass and you walk out in nature, you are literally offloading negative electrons to the earth, and it makes you feel better. There are studies that show that being out in nature, being in contact with trees, actually thins the blood, decreases the blood's viscosity. So we can't discount it. Do we understand exactly the mechanisms? No, but there's a lot of things in life that we don't understand that just are, and we're figuring it out slowly. But a lot of that happens on the subatomic level, and it's quite fascinating. So, so acupuncture, and these are acupuncture needles, and there's a lot of different acupuncture needles. Some of the original acupuncture needles were called bean stones or bion stones, and these stones were actually used to go into the skin, and they would cause the body to bleed. You would actually cut the skin with this little sharp stone, and that would allow the blood to flow, and it was thought to decrease congestion and stuff like that. What we now kind of in Western medicine know is we call it dry needling. We don't draw blood, but we will insert the needle into the skin around where the tissue is bound up. They'll twist the needle, and you can feel the adhesion on the needle, and the needle won't spin. So when you go in to do that dry needling close to an injury site, you can stick it in the needle, or you can stick it in there, and you can twist it. And so, like on her low back and her piriformis, you go into that piriformis on her right side, and it sticks. You go to a piriformis on her left side, and you can spin the needle. And so that's actually called dry needling.
I love it.
And so let's take a moment to kind of explain. So, like I said, there's a bunch of different needles, there's a bunch of different ways that they insert these, there's plastic needles. The needles that I use are encased in a bubble packet, and it's sealed with nitrogen gas. And then when I pull that open, the gas is released, but now you have the needle. And the needle is one solid piece of metal, and at the top, it is wrapped around itself. So when you look at that and you start to think about that, what is that like? That's like an antenna. So a lot of people think incorrectly that when you stick somebody with an acupuncture needle, you are letting stuff that's on the inside out. And that's not true when we have learned about this. When the needle goes in, because it is an antenna or a conductor, it actually pulls the energy from the outside in. So in Oriental thought or Eastern medicine thought, you are taking energy that is outside the body and bringing it into the body to charge the body so that it heals. Western medicine likes to think that if she has an issue in her shoulder and I acupuncture her shoulder, we are creating local trauma that the body now knows, hey, there's a small injury here. We need to go to this area, increase metabolic activity, and start to heal. So that's kind of how dry needling works. Dry needling works by creating more of a localized pressure. You spin the needle to attract the adhesion, and then you break the adhesion. And so when we use this, I like to do both local acupuncture and then what we call meridian acupuncture, but it's looking at the lines of energy in the body. And I like to use those to help unplug things or get rid of what we call stagnation in Eastern medicine. But there are several points. I'm going to do a couple points on Jessica's hand.
About stagnation and what it looks like.
Well, stagnation. So if we use a meridian machine, which they actually have meridian machines, they work kind of off of microcurrent. And what these machines do is they measure electrical resistance in the body. And when we are using those machines, it will show where you have resistance, and then you can go needle around that area above or below. I actually like to feel, and as you run your finger over an acupuncture point, you can feel the resistance. And I go into where the resistance is to help relieve that stagnation. Now, what usually ends up happening, like on Jessica's low back and on her piriformis and stuff like that, when I go into that area, when I retrieve the needles, it typically bleeds, and the blood is typically very, very dark, very black, and that's a sign of stagnation in Eastern medicine. So if we come down here, the needle is very, very fine. What you're seeing is actually the insertion tube right now. And I just put that right there, and I do a tap.
I don't think they can see.
I just put it in there. I just did a tap. This is actually a needle that I would use on the low back, or I would use on the in the piriformis. If you can see, it's kind of right where my nose is on the camera. It's right in front of me. So that point right there is a pain point. And I use that a lot with patients. There's a endorphin point here that I will use a lot with patients. But do you even feel that when that goes in?
No.
You know, when I put it in, you didn't see her flinch, nothing like that. Acupuncture needles, if you feel anything, at worst, it feels like a mosquito bite, I would say.
I've had a lot of acupuncture and dried needling, and I've nothing more than a pinch. I've never felt pain. The only thing, pressure sometimes when they are dry needling and they are twisting.
Yeah, when you're twisting and you twist into a scar, so what that looks like is the practitioner will come here and they will turn this and see where she's at. That's a pain control point. There's not a lot there for her, and that doesn't cause it. It's not grabbing. It's spinning freely. So I'm going to go into another pain control spot. And once again, I just like to feel, and for me, it kind of feels like either a hole or a lump, or it just kind of grabs me. And so I spin, and there's not a lot right there. And so we can do meridians along the arm. You can do the meridians. There's 12 meridians, 12 major meridians. There's actually a point on top of the head, way on top of the head, called 100 meetings. And if you reach up here, like I'm bald, so you can see on me real easy. And you can reach up there and you can kind of push around and you can feel it, and it's kind of uncomfortable. It's a little tender. Is that tender on you?
Mm-hmm.
And so if you go right into there, that's a very important point, because 100 meridians, and you just heard me say there are 12 major meridians, but 100 meridians meet at that point. And a lot of, you can get into the mystic side of it. I don't really get into the mystic side of it, but I absolutely usually hit that point on a lot of people and they can tell a difference. So you have acupuncture on the soma, on the body, and then there are really, really powerful points. Turn your head and look that way, in the ear. So these, what are those called?
Date piercings.
Those dade piercings for headaches are actually acupuncture points. There's a lot of acupuncture points in the ear. There's a belief in acupuncture that only acupuncturists should do the piercings, because that way you don't hit major points, because there are points in the ear that you can go around.
Well, and a lot of tattoo artists do these. Mine are for migraines, so my date piercings were for headache issues, and I usually don't get migraines anymore.
And so then in the ear, think of the ear as an upside down person. So the head is down here, and then we come all the way up and around to where the feet and everything are. That's on the inside of the ear. But then I like Shin Min because that's a big, big reset point. And to help her on her piriformis and low back, I would go in here. Go ahead and look at me here for a sec. And I would feel in there, you can look for blood vessels, distended blood vessels, that also identify areas of restriction. And the interesting thing about this, whether you want to believe it or not, they've actually done studies where they have covered people and they've looked at the meridians and they said, okay, this is the liver meridian, or this is actually one that was fascinating, is they were looking at functional MRI of the brain. And as they were looking at functional MRI of the brain, they were taking a light and shining it on the spot on the heel that goes to there. And just that light actually lit up the spot in the brain that they were stimulating with the laser on the heel. And so it is fascinating on how fast energy works. It's kind of like, have you ever had that? Have you ever moved out of the way really quickly and avoided getting cut or dropping something on yourself? And a lot of acupuncturists believe that that is that sensation, that is that ability for the body to know that there's danger coming and to get out of the way. And it's faster than a spinal reflex. So they look at the body like a matrix. And so when you start to break that crystalline matrix on the skin, that tells the body where there's an injury. So what do you think people would be interested in knowing about acupuncture that I haven't covered?
So talk about like the main uses, like for what we use it for, and what most of the time people come in for.
So most of the time people actually come in for headaches. And when they're coming in for headaches for acupuncture, we generally do a combination of localized and distant acupuncture. Realize that in the Orient, they use acupuncture for everything. They use it for AIDS, they use it for blood disorders, they use it for everything. So you have to ask the question, why do they do that? And they do that because acupuncture is not only a method of healing, but it's a method of promoting health and wellness. So we're one of the only countries in the world that is reactionary to disease. Most countries, people see their acupuncturists, they see your health and wellness people because they want to remain functional and they want to remain healthy. We want to sit here because honestly, we chase the almighty dollar and we want to run ourselves until the point of breaking, and then we want to go in and get a pill to fix it. And the body does not respond to that well. I mean, look at our chronic illnesses that we have. We were actually just speaking with another practitioner, another provider, about how Western medicine fits a niche of acute care, but it is failing on chronic care. And why does it fail on chronic care? Because usually it's the cause of the chronic care. Because we give things like anti inflammatories to decrease inflammation, but then chronic use of that same anti inflammatory causes inflammation. It's good in the short term, but not in the long term. Did I answer the question appropriately?
Yeah, we also use it. We have used it. It's good for nausea.
Yeah.
A lot of people with pregnancy that don't want to take medications, it's good for nausea. It helps with addictions. We use it a lot for pain, of course, and calming, stress relief. So, weight loss. Funny thing is like you see all the people that have the piercings in the nose. I don't know what you call that one, but that actually is, I think they do it for adornment now, but that's actually a point that they used to use. It's a clip, but that's actually a weight loss point.
And so it's just another tool to help you get through whatever ails you. And that's the whole idea behind Integrated Health of Indiana. Integrated Health of Indiana has all of these tools to help you, whether you're suffering from acid reflux or you're suffering from diabetes, or we're now treating a gentleman with severe plaque psoriasis. Those are the things of thank you for sharing that, Susan. That's interesting. Susan, I see you on here, but I don't see anybody in the viewing thing. um, but we are treating a person with plaque psoriasis because it's about augmenting health and it's about helping the things that the medical doctor is already doing. And our one patient that you've heard us talk about that had out of control diabetes, was his blood sugars were in excess of 300. His A1C is now right at a 6. So that's the pre-diabetic range. And his medical doctor has come to the realization that he has to start to bring him off of all of his medications because he's starting to get low blood sugars, like she called several episodes ago. And let me, I'm not bragging and I am not saying that, oh, hey, look at us. We work with these guys, we work with their medical doctors to help you.
But a lot of medical practitioners don't believe that you can cure or take the body from a diabetic state to a non-diabetic state, and you absolutely can.
Yeah.
And the gentleman that actually
times. This
came
is
in
just an incredible case.
Didn't believe because his blood sugars were pushing the 400 plus range, and he was taking multiple medications, and it still wasn't controlled. And he was
He was on 4.
very cautious, but came in for his wife, but had the most dramatic results, all mostly with diet change.
Well,
and we're super proud of him.
Yes, and that's one of the things that we work with people on their lifestyle stuff, and that's key. And that's the other thing is, if you don't want to change your lifestyle, you don't want to change your habits, we're not the practitioners for you. We don't want to waste your time or your money or our time, because it's not worth it if you're not willing to change bad habits and decisions that got you to where you are, whether you know it or don't know it. A lot of people don't, they didn't have a choice in their autoimmune disease. Things that they just didn't know. But it's our job to educate so that you know that these things happen. And then it's our job to help find your way out of this.
Well, and it doesn't have to be a chronic lifetime issue.
No, no.
You absolutely can change a lot of it.
The younger you are and the younger that you start this and you start to be healthy, the better and the faster you get out of it. And unfortunately, that's the truth of it, because if you have 30 years of bad decisions, and as opposed to me well, I don't have 50 years of bad decisions, but let's say just because I'm 20 years older, I have a longer area under the curve. And then that's where our tools come in to get rid of the things that plague you. And like I said, we work with your medical doctor to get rid of those things. And then let's see if she bleeds. I don't think that she's going to. The ear might. I don't think she's got any real stagnation down here.
No, and a lot of times I don't know if you can see that, but like you might get like little red spots.
It is a
And
puncture.
sometimes people do bleed a lot, and it is usually very dark.
Yeah, it's almost black, and it's amazing because it's like, why is that black? Now, sometimes your shin men will bleed, but everything moved freely. Everything did great.
They actually, um, it's not real pain, but like you can feel the discomfort of pulling them out. Most people complain more about having them pulled out rather than being put in.
Another thing to think about.
Did you get the one on top of my head?
Yeah, when you're doing acupuncture with somebody, sometimes, especially if they're seated, when the chi arrives, when the energy arrives, when the energy is unblocked, the needle will push out on its own. We have people all the time that their needles pop out on their own.
They won't stay.
Yeah, and that's okay. That's normal. So, this is just another tool in the universe. It's another tool that Integrated Health of Indiana has to help you reach your health goals. It is absolutely fabulous for taking people who are wound for sound and ratcheting them down, especially the way that we do it. I mean, I don't think there's any other practitioner that does what we do with acupuncture to bring people down with using aromatherapy and using all of these other little tricks that we do.
It's very calming.
So,
also, there's a lot of points in the ear that helps reduce blood pressure.
Yep. I think for acupuncture, that's it. What do we have coming up? Anything we have coming up? I think I'm working on a diabetes actually class, a diabetic master class. We'll kind of announce that when that's actually ready. And
cookbook. We're going to do a cookbook for that.
yeah, we are going to do a cookbook for that. And we just look forward to helping you. And there are some really cool things in the pipeline um, that are getting ready to come down the pipeline where hopefully we'll be starting to, I'm just putting it out there in the universe so it happens easier, but adding multiple practitioners, adding, really bringing to this area. I think I got an ant on me. Bringing to this area the health and healing that people deserve.
Well, and like a goal dream of like a wellness center.
Yes, where we offer things like ozone therapy and hyperbaric oxygen, and we stick with the acupuncture and the functional medicine and the chiropractic,
The nutritional IVs,
because,
lots of goodness.
well, in your case, just as a side note at the end of the acupuncture thing, talk about how you've done with your Lyme and Lyme issues and the cycling of the Lyme.
So, well, I've talked about it freely a lot. Complaints, really, just chronic fatigue, debilitating joint pain, migraines, skin issues, and we combed over test after test. I even went down journeyed with an MD and told my story over and over and over again to multiple specialists. Just the flare in the back pain. And so we were just lucky enough to be able to see a practitioner that specialized in Lyme. And as we researched it, it kept coming up. And I specifically remember having multiple tick bites. And then I don't like red meat. Actually, I don't really enjoy meat at all. And have really had eliminated most meat except for pork and a little bit of chicken. And then met a really great practitioner, and her story resonated. And so we thought, the Lyme test that we had done was negative, but there's 70% false negatives. And
Your
especially
genetics,
if there's
when we did your genetics,
especially if it's chronic, but the genetic markers did come up for Lyme. So in the test, I think was upwards of $2,000, but the actual treatment was really minimal when you think about it in the big scheme of things. But so my pain would cycle, and so that was an ongoing thing. About every 4 to 6 weeks it would cycle back around, and it would wax and wane, so get worse and then it would get better, but it would always come back, and like year after year. So I actually haven't finished the protocol yet, but I actually feel a lot better. So I've done that for at least 2 months.
Well, no, you've done it for 3. So let's.
But there's a huge commitment.
Yeah.
I think I was at 27 supplements.
Oh God. We use a protocol that's
3 times
proven.
A day.
Yeah.
So it for me it's work, but I actually stuck with it because it took a while, but after like 6 weeks I did not cycle back again. So
well, and you got stung, and you didn't have
I did not have a reaction, and I actually have EpiPens for bee stings, and I did not have to use. I actually just got stung by a bee and did not have to use the EpiPens, and I did not get a massive swelling. So for me, that's like life changing.
And so once again, these are just like tools that we have at our disposal to help people. And in her DNA, we absolutely walk our talk. I think you have every test that I know you have every test that Designs for Health does, pretty much. You have most of the tests for Genova. You have the most in depth genetic testing that they offer. We've done, I'm not a big fan of food sensitivity testing. After she's done with the protocol and she feels good and whatnot, I want to retest her because when we tested her the first time for food sensitivities, she lit up like a Christmas tree. That is a sure sign that you have inflammation and a leaky gut, especially because before we did that test, she could eat those things up until a certain point, and then after that certain point, things went south. That's a sign that it's not a true food sensitivity. It is most likely a leaky gut. So, and you depend on that barrier, that leak, you depend on that slime barrier, and you depend on that bacterial barrier. You depend on that for your immune system. And if that is not intact, then there are bad things that can happen. So I think we've about
Yeah.
covered everything,
So
right?
yeah, but if you suspect you have had Lyme, or if you've been tested and it's negative, but you still have symptoms, Lyme disease actually is the only disease that cycles, that has
Yeah.
a cyclic pattern, and we can help.
Well, we can help and we can do a genetic test for it that shows where they've done studies and these certain genetics show up in people with Lyme disease, so we can start to see Lyme like and Lyme disease in those things. So, and then we can help with it. So, thank you very much. We got to go get a pineapple whip.